Active Arm Supports has spent nearly 10 years developing and perfecting the LuxArm shoulder subluxation brace and arm support system specifically for people who've had a brain injury. After a stroke, nearly 81% of those who survive have hemiplegia or one-sided weakness, and as many as 37% of those people also suffer from shoulder pain. Upper extremity rehabilitation after such a traumatic event is slow, challenging, and very complicated. One of those complications is the shoulder subluxation. This type of separation at the glenohumeral joint is not the same as a subluxation that occurs from an awkward force and does not heal the same. The orthopedic shoulder subluxation only needs a few weeks to recover, and the distal arm is still functional during that time. Yet, a shoulder subluxation that occurs because of a brain injury takes several months to years to recover and can be further complicated by soft tissue injuries, changes in blood vessels and nerves, sensation abnormalities, fluctuating muscle tone, and/or muscle paresis throughout the entire arm. The LuxArm is a complete arm system that does more than just provide effective ergonomic alignment of the shoulder joint. It also takes into account those other neurological arm complications that often occur with a stroke. Careful attention and deliberate design have been applied to every aspect of the LuxArm so that it supports the entire paretic arm throughout the many phases of recovery. Active Arm Support's innovative and holistic approach not only supports best practice research for management of the shoulder subluxation, but it also has the potential of possibly preventing the subluxation as it can be used in the very early stages of recovery. Here's a closer look at the unique and deliberate design features that set the LuxArm apart from other existing positional devices. The innovative belt system. The belt's core is made up of lightweight aluminum that can contour the body. This provides malleability during customized fitting and reliable stability throughout the day. Two different sizing mechanisms make it easy to create that just right fit. The visible ratchet system in front allows for quick, one-handed adjustments needed throughout the day for comfort with various position changes, and also allows for easy removal of the belt. The zipper-hidden Velcro feature in the back is used for initial fitting and can accommodate changes in weight that may occur during recovery. Soft, dense, antimicrobial padding at the hips prevent pressure points, adds comfort, and is easily spot cleaned. Exclusive to the LuxArm, the belt is equipped with a unique vertical sliding track to faithfully minimize any size shoulder subluxation. The thoughtfully positioned angle of the track allows some elbow flexion and extension and creates an easy connection point for the forearm piece. Additionally, the LuxArm has a quick-release, rubberized locking system that practically and simply releases the forearm from the belt, so therapy exercises can be done with the distal arm without removing the entire system. The fully adjustable forearm system. The elbow to fingertip length ensures that the whole arm is appropriately and therapeutically supported throughout the day at the same time the subluxation is being supported. A circular pin connector on the underside of the forearm component permits some freedom of the shoulder into internal and external rotation, which is important to allow during gait training as tone in the arm can fluctuate with effortful tasks. The sliding track also on the underside further promotes the ergonomic alignment of the humeral head in the glenohumeral joint by moving the elbow anterior to the hip. The core of the forearm piece is a moldable, lightweight mesh aluminum that is durable enough to handle repeated shaping. This is critical in recovery, as the hand often presents with numerous and frequent changes in spasticity and edema that require position modifications. The distal end can be individually formed into a large range of flexion, extension, or combination of both to accommodate comfort needs of the wrist and fingers, while the forearm can be rotated for equal muscle balance. The customized shaping can provide ergonomic and conservative positioning of the hand, or it can challenge the wrist and fingers to stretch into more functional positions for therapy. The LuxArm aligns with best practice research in that it completely supports the shoulder subluxation from below the elbow, and it is totally unique in that it supports the heavy weight of the entire paretic arm across both hips. Rather than trying to minimize the inferior subluxation by pulling it up against gravity and strapping the shoulders, Active Arm Supports has used a similar philosophy as the backpacking industry and distributed the load evenly across the hips and waist, freeing up both shoulders. Soft padding strategically positioned prevents pressure points, and the elastic Velcro strapping is easy to use with one hand. Strapping is designed for security, but allows for quick adjustments, and the antimicrobial material is washable for practical purposes. The LuxArm is a comprehensive, progressive system that pays careful attention not just to the neurological shoulder subluxation, but also to the ever-changing needs of the entire paretic arm. The multifaceted system respects the complexity of the neurologically impaired arm, but the design is fully functional and intended to adapt to the client during their many phases of rehabilitation. Knowing that early biomechanical positioning of the entire arm can lead to more advanced treatment interventions later in recovery, the LuxArm shoulder subluxation brace and arm support system breaks new ground in how we think about and treat the upper extremity after a debilitating brain injury. Regaining shoulder and arm function is a critical concern for survivors and therapists alike. Active Arm Support's LuxArm is an innovative tool to facilitate recovery after a brain injury.